scapula, and also we study the strengthening technique, okay, and then the trigger point for trapezius muscle. So this is the basics the muscle that we'll talk about. First, the trapezius muscle. You guys can open your. Can you see the notes? Yeah.
Yeah.
Okay. So, the picture on the back here, this show you all the muscle, the superficial layers. We have the trapezius. Yeah, the trapezius have we have upper trapezius, middle trapezius, and then the lower trap. Okay. And so everybody know the trapezius, right? This is trapezius, the one right here. The one that from here down is like become like a. If you look from the behind, trapezius is look like this. The shape is like this. Yeah, yeah, like diamond exactly. And then it's so the function for trapezius. First, anatomy. The picture. Look at the anatomy of the trapezius, and then the function is help to elevate and then retract the scapula. So it's help to do this and also do this. Okay. Also, trapezius also help you to hold the scapula, yeah, so that it can allow the deltoid to move the humerus. Okay, so it helps to stabilize the scapula, so that it can help the deltoid to move the humerus. So if I do this, see this is I use my upper trap, also my levators. So people with this kind of posture over time, people like computer work for many years with shoulder elevation, and can have over time they can have muscle tightness, trapezius muscle tightness, and that can give them the trigger point. Yeah, trigger point on in your body. You see the most trigger point is on the upper trap. Yeah, upper trap you can find the most common location for trigger point. Okay, and then so function for trapezius is elevate, retraction, and also stabilization of the scapula. So origin, insertion, actions. So I don't expect you to know specific origin, insertion, but at least you have an idea, visualize in your body, in your mind, that how that muscle look like, right, on the back of your head. Yeah, and then the innovations of the trapezius is innovated by spinal accessory. Yeah, so spinal accessory is the cranial number 11, right? Yeah. What else spinal accessory innovate? What other muscle that spinal accessory innovate? Anyone know? Scm Sternocleidomastoid. Okay. Looks like it's not working, huh?
They changed the things, I'm not sure how.
So we usually we have to connect this. Have to go to the cable, right?
It is connected.
It's
They
connected.
changed
Where it's connected?
so this is connected to the computer right now.
Oh, I see. Oh, okay. But now it's not working, huh? It's okay. If not, then we'll say because everybody has the PowerPoint, right?
Yep.
Yeah.
Yes.
Yeah, and then it's okay. If not, we cannot open it. Then we just.
Oh my God, I couldn't recognize it. What, charted? For what? Let me ask it. And do you have charger for like this?
No.
Connect to a
No, sorry.
projector.
Oh, wait, can mine be
You,
distracted?
you have it. Yeah, yours is the correct one.
Sorry, I don't know. I didn't know it's this one.
It's okay. Maybe ask.
Oh, it works.
No.
That's an HDMI right here. Out.
Is it connected?
I don't know.
Oh no, there's something out.
HDMI.
It look like that. Enough. Good up, huh? Nope. No signal. Nope.
I don't know.
It's okay, forget that.
Where-
Oh, this is the another one? This one we hook up directly to it, right?
Yeah, maybe you could do it like that.
Tuition for externship, the same to internship.
Yes.
Oh yeah.
Yeah. You also cover
I just
Palmer?
told Cobra next semester I'm gonna drop. I'm gonna do all
When did you graduate?
clinic. 5 intern, 5
You need
external.
those glasses, don't forget.
Huh?
You need the glasses.
I know. Oh yeah, you're right. I'll do on by class.
If they're online.
Okay, so injury to the trapezius muscle can damage the spinal accessory nerve, yeah. And with the spinal accessory nerve damage, you can have a drooping of the scapula. So because the trapezius is holding the scapula up, right? So if you have a damage to that nerve, what happened? The scapula drooping down like this, yeah. And also you can have a we call winging of the scapula. Winging of the scapula. Winging of the scapula also can caused by long thoracic nerve damage, or anterior serous anterior muscle weakness, and you can have winging of the scapula.
Short.
It's too short.
No, you
Let
need,
me push the
you need
table.
HDMI. You need HDMI converter.
No, that one is still okay, right? That one, after that one, you can hook up on the side here.
Oh.
But let me move the table a little bit closer. I can move the table a little bit closer to there. Yeah. We can move the table on this side. Let me see. So that is right on the middle of the screen. So just keep talking, okay? So people with the spinal accessory damage, you see the shoulder drooping. This is like, for example, the shoulder is like this. We call drooping of shoulder. Okay. So drooping of shoulder, what happened? What is the consequence of the drooping of chronic shoulder drooping? That, and over time it can cause like impingement syndrome on the rotator cuff, impingement syndrome, because when your acromion process or the clavicle drooping down, what happened? The bursa can compress on the supraspinatus, and you can have impingement syndrome. Or people with the drooping, chronic drooping of the scapula, they also develop adhesive capsulitis or frozen shoulder. Okay, so spinal accessory control the upper trap, control the Scm Sternocleidomastoid. Spinal accessory can get damaged by overstress or any direct penetration, like penetration into the trapezius, or direct injury, like you got some, especially the hockey stick. People playing the sport with a hockey stick. Sometimes it can jam, get hit on the hockey stick to the trapezius and damage spinal accessory.
So small.
That's okay. I think everybody can have the. Yeah. Oh. Yeah. Better. Let me push this a little closer. Is it better? Oh, beautiful. Thank you. Yeah. Okay. Or a direct blow or a stretching of the nerve during a fall, or car accidents, or in a sport a blow from a hockey stick, so that can damage the spinal accessory. With spinal accessory damage, the symptom patient might have, let's go to the clinical symptoms, might have dual aching pain, weakness, deformities, lost the function of the trapezius. Okay, drooping of the shoulders, asymmetry of the neckline, winging of the scapula, the loss of normal scapular rhythm, and downward drooping of the scapula. So, because of the damage to the spinal accessory, the shoulder drooping down. With that drooping down, what happened? It can, the bursa, it can compress on the rotator cuff, supraspinatus tendon, and that can cause, we call impingement syndrome, acromion impingement syndrome. You guys remember impingement syndrome in previous class? So that's what is the impingement syndrome? Impingement syndrome of the shoulder, it can cause by first bone spur on the acromion process that compress on the rotator cuff tendons. Okay. Second, it can cause by the swelling of the bursa, subacromial bursa. That also can cause impingement syndrome. Okay. So, and then also people with the spinal accessory nerve damage, they also have winging of the scapula. So what is the winging of the scapula? So this is the winging of the scapula. You see this? Yeah? So because of the damage of the spinal accessory, and now the muscle, the trapezius muscle can be weak, right? Trapezius muscle is weak, then the shoulder will droop it down and then also turn it out. Yeah. Winging of the scapula also can cause by damage on the long thoracic nerve. Yeah. The long thoracic nerve is control the serratus anterior muscle. Yeah. Later we'll talk about that muscle later. Okay. But the muscle is on the front of the rib and attached to the scapula. Okay. So this is differentiate between the spinal accessory nerve damage and then long thoracic nerve damage. Yeah, so the forward elevation does not result in winging of this patient, differentiating spinal accessory nerve palsy, winging from the long thoracic nerve palsy winging. So patient with the long thoracic nerve spinal accessory damage, when you raise the arm up, so it does not cause the winging of the scapula. Okay, but if people with the long thoracic nerve damage, when you raise the arm up, you might see the scapula was winging out from the sides. Okay. And then, so good thing that all the peripheral nerve over time it can regenerate and can recover. Yeah. For the spinal accessory, for people with the spinal central nervous system, the brain, the spinal cord injury, when it's injured, it never recover, right? But people with the peripheral nerve damage can regenerate over time. So usually people with the spinal accessory nerve damage or trapezius muscle injury, they got through rehabilitation, right? The stretching, the strengthening technique, right? So the purpose for the stretching to break the scar adhesion between the muscle fiber, yeah? Because when you get injured, what happened? Your body will bring more fiber tissues to heal the wound, right? But with the fibrous tissues can cause a scar formation. Yeah, with the scar formation, you can have a acute pain become a chronic pain. So what is the stretching will do? The stretching will break the adhesion between the muscle fiber. And so the stretching will align all that fibrous tissues in the same directions. Okay? And then the strengthening will help to strengthen the muscle. Because when the muscle get injured for a long time and you're not using it, what happened? The muscle will get weaker. Atrophy. Yeah? Atrophy, weak and atrophy. So when it's weak and atrophy, it's vulnerable for more injury. So that's why it's very important that after you get injured, you have to get good rehab. The rehab is combined between the stretching and the strengthening technique. Right? Because especially the stretching. You know, some people say, oh, I got injured. I don't care, it hurt me for a few days, and then, you know, especially they're very active in the sport. They're very active in the sport, and then they get injured, tear the hamstring or tear the quadricep muscle, maybe grade 1, grade 2 muscle strain. And after strain for 2-3 weeks, they recover. They say, oh, I'm fine. You know, beginning I got hurt, but now I'm okay. And they didn't go through any rehabilitations or any kind of treatment. And then what happened when they go back, and then they got re-injured again. And now it gets more severe. Why is that? Because very simple. Because think about it, when you have muscle, you tear the muscle, and your body will bring more fibrous tissues, more fibrosis, and to heal, right? And in that way, is the fibrous tissue is not on the same direction with the muscle fiber. It might be crossed over like this. Yeah, it's like become a scar formation, scar tissue formation. So with that scar tissue formation, every time they stretch it out or they overstretch, it can tear again, or it hurt. Yeah. So professional athletics or professional sport player, they always get a rehab after they get injured, because rehab will help speed up the healing process, prevent scar tissue formation, and also increase the function of the joint, the function of the muscle. Yeah. So how about us as an acupuncturist? What can you do? With the treatment alone, you help to bring more circulation to the area. You promote the healing, but not enough. You also show the patient how to do the stretching, the strengthening technique, yeah, to prevent further future injury. Make sense? So, for example, if people have an injury to the trapezius, yeah, you can do cupping, you can do wasa on the muscle, yeah, good. Cupping and wasa is a good way to bring more circulation to the area, right? When you have more circulation, what happens? Your body will recover faster. The area that you have less circulation, it takes longer to recover, or never. Sometimes it never heals properly. For example, the knee joint, yeah, the shoulder joint. When you treat people with a rotator cuff injury, take long to recover. Yeah, because it's so deep. Yeah, the shoulder is so big. Same thing with the knee joint. Yeah, if you injure your meniscus, it takes long to recover or never recover. Why is that? Because you don't have much circulation into the disc, to the meniscus. Yeah. If in the muscle, you get cut a few days later, it recover, right? Because why? Because on the muscle, inside the muscle, you have a lot like blood circulation. Yeah, with good circulation will bring more oxygen, not more nutrition to nourish the muscle. Yeah. So lack of the or limit the circulation will slow down the healing process. So all the cupping wasa, on the muscle will help to invigorate the blood, bring more circulation to the area. But too much wasa is not good, especially when you have a chronic condition. Yeah. Remember you saw the case this morning in our action shape, right? The lady do washa for many years. She say about 20-30 years at least. Every time she have neck pain, she washa on her neck, and you see her skin is thick, so thick. The more you washa, what happen? It bring more fibrous tissue underneath. Because it causes inflammation. Yeah, that inflammation, your body will bring more fibrous tissues to protect you. And it makes skin thicker, make the muscle get thicker, and some patients have I see some like nodule on the side of the neck. That's bad. So washa is only for temporary, but you don't do it all the time, especially when you have a chronic condition. Okay.
Could it be because of the technique, like the heavy you do it all?
Your body, like this. Some people like beginning they washa less pressure,
Right.
but your nervous system get used to it and they feel less and less. They don't feel it, and they have to rub harder in order to feel it. You try it. The first time you do washa, it hurt you a lot. But the second, the third time, your body will get used to it. And then you keep doing that for many years. What happens? You keep rubbing harder and harder. Yeah. Then what happens? The muscle, the skin layer get thicker. The muscle underneath the muscle get more inflamed, and more fibrous tissue build up. And sometimes it make a little nodule, big nodule, tender, very, very tight. So this morning, that lady, her neck is so thick, skin is thick, very tight, and you can see it. Very thick skin, and then the muscle layer is so hard. There's too many trigger points. It's not good. No, so don't do washa too often, especially need to find out what is the problem. You can do it in this case. You can do the washa to help invigorate the blood, bring more circulation to the area. Right. Local needling, also helps stimulate the circulation to the area. Resistant exercise, to strengthen the muscle, to eliminate pain, and also improve the grouping of the shoulder. So let's see. We talk about the stretching and strengthening technique for the trapezius later. So the trigger point, trapezius. So trapezius trigger point is often result from an acute or from a chronic overuse of muscle. Most of the time in this Bay Area, you see for repetitive, acute, chronic overuse, people with a bad posture, looking down like this, hand up, people working the assembly line, people with in hair salon, and nail technicians, or now even people like, student, we call Texan syndrome, holding the phone, looking down like this every day, like many hours, computers. So that's where every time you elevate, see this posture you elevate, you use your trapezius levator with head forward like that. It creates a lot of tension on your trapezius. Okay, so that over time it can cause the little nodules on your muscle. Or people using the phone, put the phone on the side like this and with the shoulder up. Trauma, injury, car accident, whiplash. Whiplash accidents like require with hypoflexion, with hyperflexion and hyperextension maneuver. So with hypoflexion like that, it can damage all the, people can damage the levator, trapezius, it can damage into the ligaments layers, especially in the cervical spine. The muscle layer is so thin, so weak, right? So every time you have whiplash accidents, yeah, or any injury like this hyperflexion injury, it can damage your muscle, but at the same time it can damage your ligaments. The ligament, it can go into the interspinous ligament, go into the ligament of flamum ligaments, and also can damage to the PLL. PLL stands for posterior longitudinal ligaments, yeah, the one that stabilize on the inside of your, behind your vertebral body. Very tough ligament. Those ligaments very important because those ligaments prevent the disc go into your spinal cord. So when people have rupture that ligament, it can be very dangerous because what happens is your disc can protrude, yeah, into the spinal cord, can damage the spinal cord. Yeah, not even that, the segment, the whole cervical segment become very unstable. It can dislocate easily. So when the ligament ruptures, the ligament is holding the joint together, right? Yeah. So you gotta remember the function of the ligament. They're holding from one bone to another bone to help to stabilize the joint. Yeah. But when you rupture the ligament, the joint becomes very loose. So when very loose, what happens? It can cause dislocation. Okay. So whiplash, compression force that carry the heavy backpack to the shoulder. Okay, so trapezius has the most commonly found trigger point in the body. See that? Why is that? Because you use the most, right? Every day your hand up, only you use your hand, use the shoulder, then you have to use the trapezius. Okay? So the classic trigger point in the trapezius tend to produce the classic stiff neck, okay? With restricted contralateral flexions. For example, if I have my stiff trapezius problem on this side, okay, it will limit me with the contralateral flexion. That means it will limit me flex to this side. Because this side I'm so tight, right? So when I flex to this side, it hurt or it's limited. Okay? And also ipsilateral rotation. So if I have my neck, I have a problem on the right, it will also prevent me to turn my neck to the right. Yeah? So people with classes with trigger point, especially with an upper trap, they have you ask them to, if I have on the right side, it will, if you ask me to flex to the left, it will be limited and also it hurt more. If I turn to the right, also it limited, also it hurt me more. Okay? And then if you go along around the GB21 area, you can find some little nodule. Yeah, some spot. Yeah. Those spots, when you press on it, it might refer, the pain can refer down the shoulder and also refer up to your, along your gallbladder channel. Okay? We go into the picture, we see the picture.
I have a question.
Yeah.
If there is any gallbladder problem,
Gallbladder problem?
because GB.
You mean
channel-
the organ? You're talking about the organ,
organ,
right? The gallstone, right?
If you
Usually
have-
the stone is the pain is more on the
Right.
on the inferior border of scapula. You don't see in TCM. Is the gallbladder is not the organ. Gallbladder it represents for the system. Same thing the kidney. Okay, so don't make a mistake between the kidney organ in the Western side with the kidney function in the TCM. So some a good question. You might see on some medical doctors say that, hey, you know, some patient comes and tell you that, hey, I went to see my doctor. My doctor say my kidney is okay. How come you say that my kidney have a problem? Okay, the Western medicine, the kidney, they talk about kidney, the organ. Okay, but when in TCM, we don't talk about the organ, we talk about the function. The function of the kidney is including all your productive system. Yeah, the function, you know what I'm talking about?
Yeah.
It's not it's the structures, okay?
But what I'm saying is, if a patient
Have the
has
gall-
a systemic problem with
Uh-huh.
gallbladder,
Uh-huh.
would the patient have more like prone to get trapezius injury?
I don't know. That's a good
Okay.
question. Yeah, that's a good question, isn't it? Yeah. How about you ask your some internal medicine's instructor, see if they can answer you that question. Yeah, that's a good question, isn't it? Yeah. Have more room for have a trapezius or have more like trigger point in your upper trap, yeah? Or yeah. Yeah, that's a good question, yeah. Yeah. If you have like something like gallbladder problem, and okay, I don't know. You find out. Ask the people like more internal medicine, they can explain you better. I'm not an internal medicine guy. Okay, so the one that we talking, I'm lecturing right now is more the western part, but we relate some channel to it. Yeah, but go into the functions of the each system, then how it relates with the
I think I saw like some of the like referred pain maps.
Hmm?
Like some people like have
Yes.
red
Yeah,
maps.
no, we have it here. We have it.
Yeah,
Go,
yeah,
go down, go down. Hold on. We have it here. Right, there you go. This is a referral from
Yeah,
trigger
yeah.
point for trapezius. And I know if you look at this picture, it looks like a gallbladder channel.
Right.
Maybe this, you never know. This guy who invent this could be have some background in Chinese TCM, or he might have a.
Maybe got a hint from.
Yeah, exactly. Who make this? Who invent this?
I think that the trigger point was the doctor guy, but a lot of the points are on acupoint.
Acupuncture. This is if you look at the referral pattern.
70% of them.
Referral pattern is look like right on the gallbladder channel, right? But
So that's like on GB21, that X, right?
yeah, it's GP going to go up all along the
So
gallbladder
blocking the
channel.
cheese,
But you look at it like this. See that? It's like a gallbladder channel.
Yeah.
He might have some background in TCM. Yeah, or he might read some book on TCM and refer. But actually, you remember this morning? This morning was this morning. Yeah, it was morning. We have the lady have a neck pain and refer. She have a neck pain. She have a chronic neck pain, right? She have some disc problem issues, and she goes like that. She have a headache. Go to the ejaculatory gallbladder channel. She said her headache is to the front around GB14 here, and go on the temporal area. Yeah, it's sometimes if you palpate some patient on, especially on GB21, if she's at trigger point, you hold on to it. When you hold, you press down, and you ask that patient to focus, close the eye focus. They can feel the pain that can go up like that. Yeah, especially on me. Okay, if people can press on my shoulder, I have a lot of trigger point on my upper trap. So when they press on it, I can feel it can refer up, almost like that. Yeah, I can feel it go all the way sometimes right this area. Yeah. Okay, but this is the referral pain from the trigger point, from the upper trap. So this morning we have a patient that lady have something. She have a chronic neck pain, a lot of problem with her neck, and the pain that she describes is go along gallbladder channel. Yeah. And she got all the CT scan from the head, her neck, and her neck has a problem, some disc problem, nerve problem, and her posture, head forward until head translation. So posture is very important. Especially when you treat people with the bad postures, you treat with acupuncture alone, it's not good enough. You have to teach them how to modify their lifestyle, their work, and their habit. Yeah, people always sit like this. That's a lot of tension. Even now, a lot of young people have a neck problem. Yeah, young people, my daughter, 11 years old, she always complain neck problem. And because study like this, study even the way she study like this. You see, in the old time, in my generation, so in Vietnam, when I was in Vietnam, we study, we have to sit up straight. If you sit like this, you're in big trouble. Your teacher will, you send them you, right? Yeah, they will, with the ruler, they will. Yeah.
Are you doing that to your daughter right now?
No. no.
Just kidding.
Yeah. But in Asia, they will with the stick.
They even have like an academy for it.
Yeah. Sit up straight. So that's why there's a problem now. A lot of kids have the scoliosis. That is a study that a lot of kids have the scoliosis because of bad posture at school.
We saw one today too.
Oh yeah,
She wasn't that old.
no. She have probably for many years. See, some people have the scoliosis could be from the structural scoliosis or functional scoliosis. Yeah? So some people, you born you have that genetically. You have your spine will crooked. But people over time growing, and the spine will was crooked, and then over time you can see either C shape or S shape. But a lot of young kids now have the scoliosis because of a heavy backpack, especially when they carry a backpack is only one side, and the backpack's too heavy, and the way they study. Okay, here the teacher does not correct the way they sit. No, the teacher doesn't have time to go every single student and tell, hey, sit up straight, and no. But in the old time, like in Asia, they always make you sit up straight, and you don't sit like this.
They even have like a pen that is like electronic. If you are too close, they will beep.
Oh, really? Oh, that's a good.
Like this is like a newer technology.
Oh, new technology. Oh, that's a good invention. You make that, you'll be a millionaire. Yeah, I think that's a good idea. Huh? Yeah. So that can. Yeah. Is there a pen like that? I will buy. Seriously.
But like now the kids, they all use computer. They don't use pen that much, right?
No, they do the homework. They have to dry, and it's like this. So yeah, and always my kid always ask me to massage my neck, and even they crack in their neck. I say no, you don't do it. Then they crack the neck. Yeah, it become a habit. Because my wife, her family, everybody in the family cracking their neck. They always go like. I say no, don't do it. It's become a bad habit, and the kids see that and they follow. Yeah, and not good. So, a lot of problem. People cracking the neck, and then they keep cracking, and they have a lot of problems. Yeah. So this is the trigger point along the trapezius. Oh my God! It's only one muscle. It takes us 45 minutes. 45 minutes. Oh, okay, trapezius stretching, lateral flexion. Okay, so this is stretching is very important. You should know that every patient with a neck problem, especially when they have tightness or neck, or even in acute stage, maybe in first couple of days after injury, if it's not severe, you can help them to do slightly stretching, because the stretching that will help prevent the scar tissue formation, also adhesion between the muscle, prevent the adhesion between the muscle fibers. Okay, so you look straight ahead, don't let the chin down, and move your. So for example, and look like that. So you see, I show this patient. So they just stand up straight, tilt the neck to the shoulder, drop the shoulder down. So when you drop the shoulder down, you feel very nice stretching. Yeah, and you hold that for 10 to 30 seconds. Usually I ask the patient to count 1 to 15. 1 to 15. Yeah. So if you want a little bit more, feel more on the back, you slightly flex your head forward, and then you can feel more tension. Yeah. Hold that, and then go the other side, do the same thing. It's very nice stretching. Okay. So tilt your neck, drop your shoulder, make sure you stand up straight. You don't bend the spine like this. Okay. Go. So that's the first move. The second one, tilt your head, drop your shoulder. Now you hold in here. You hold in your neck. You pull in. And then you hold out. You count until you feel the tension. You hold out. You count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15, 16. You can count to 15 or 20. Yeah. And go the other side. Do the same thing. Okay. So that's the second. And the third one. The third one, you be like this. You flex the head, drop your shoulder. Now you use this hand. So use this hand. You pull it on down on your wrist. Yeah. Same thing over here. Yeah, you pull down on your wrist. So when you pull down, you feel very nice stretching, and then you can extend back. So when you extend back, you stretching your scalene. This part right here, this muscle right, and go the other side. Okay, and then you can roll your shoulder after that. So that's and also you can hold also behind. Yeah, same thing. Count to 1 to 15. and go the other side. Yeah? Or if you sit on the chair, you can do same thing, do the stretching on the chair. This one is not on the lecture. But this is especially people like work computer and get the neck so tight. And if you sit on the chair, you hold on the side of the chair. Be on the side like this. First sit up straight, right? Hold on the side of the chair, you tilt your head. And you feel it? You feel it? Okay, you tilt, and so the purpose for holding on the chair, pull on it to depress the shoulder. To depress the shoulder down, right? Hold count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, go the other side, do the same thing. Yeah? Okay, and that's the first move. Okay, the second one, same thing, hold like that. And now use this hand, pull on the head. Can you feel it? Stronger, right? One hand you pull down on the chair, one hand you pull on the head. That's very, 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 very nice stretching. Hold that, close your eye, focus on the stretching, and count 1 to 15 or 20 or 10. You know, if you don't have time, you do 10. But okay, usually I ask the patient count to 1 to 15. Okay, and then go to the front. Now in the front, two hand, and you pull up, you pull, and then you look down. Can you feel it? Yeah, nice stretching. So do that. Maybe this is one set, right? The second set, do the same thing. This, okay, and this. Okay, hold two together. Yeah. So you want to do about 10-15 sets like that. So that will help to stretching your trapezius, upper trap, and also stretching your levator. Okay. So know that stretching is very helpful, and especially when you treat patients with the chronic conditions, yeah, or even with the acute condition. Maybe acute condition, the first few visits, especially if they just got injured and then the neck is so sensitive, then don't do it yet. Maybe wait until after a couple days later, yeah, until the swelling subsides a little bit, and you can show them the stretching. Okay. Yeah, you got it? Okay. So this is stretching right here, and then stretching the hand, pulling the hand down. I will show you, huh? And then you can roll the shoulder. Yeah, roll the shoulder, and then reverse. Okay. Same thing. This one is so this is the put your arm in the front, elbow straight, clap your hand together, and something down like that. So this is right. Yeah, you can do this, or you can sit on the chair like earlier I showed you, pull it, and you can feel more. Okay, and then strengthening. So that's the stretching. Also strengthening. Because sometimes they get injured, and what happens, they're not using it, and the muscle can get weaker. So when it's weaker, it's vulnerable for re-injure again. So you strengthen by, there's many ways to strengthen. You can hold the dumbbell, and you can raise your arm up and down, yeah. The shrug, right? The shrug, yeah, hold up, down, yeah. Keep your arm straight. And you shrug your shoulder up, and lift it high as possible. People with especially people with disc bulging or herniations, you have to be careful with this kind of exercise, because it might aggravate the condition. I have a patient, he's very healthy, young, healthy. He's exercised a lot, and he did a lot, shoulder like this, and shoulder rug. The shrug, and then the shoulder lift the weight up and down like this way. So he got because he lifts so heavy, he got this bulging. So he have the pain that radiate down to his arm, to his hand, to his fingers. It was a long time ago, few years ago. So I sent him for MRI. So he have a bulging disc. Every time he exercise, if he work on his upper trap a lot, it's aggravate the symptoms. Why is that? Because you overuse the muscle, right? So the trapezius get too tight, and put more pressure on the spine. And what happens when you have more pressure on the spine is irritate the disc can bulge in more and then irritate the nerve more. That's why he feel a lot more numbness, more pain down to his hand to the fingers. So when people have cervical radiculopathy, so maybe don't do strengthening of the trapezius, because that can aggravate, especially when they are in acute condition or when they're in pain. Okay. But if muscle injury, if they have a injury to the trapezius, you can stretching at the same time. You can show them the strengthening technique. Okay, especially the stretching technique is important. When you look at a patient with this kind of posture, shoulder elevations, right? Forward, head, shoulder forward, and with elevate. So you know that they must have very tight trapezius, very tight on the levator scapula. Yeah, and also in the front, the pec major and the pec minor. Okay, we'll talk about it. We will go into the pec major and pec minor. We'll also we'll talk about the stretching, the strengthening technique. Okay, so trapezius. Remember, visualize the picture of the trapezius. Yeah, also visualize the acupuncture points. Yeah. And the stretching, the strengthening technique, and the condition relate to the trapezius. You have a muscle strain, trapezius muscle strain. We already talked about in previous class, so we don't want to repeat again. But the spinal accessory injury, drooping of scapula. So if you see patient coming with drooping of scapula involved with trauma, then you know this is related with the spinal accessory damage. Yeah. Involved with trauma with spinal accessory damage, then you send patient to refer patient for further evaluation with neurologist. But at the same time, you can treat patient by Iwasa, cupping, electroacupuncture like GB20, GB21, GB10, Bilao. Yeah, that's all a local point. And with the Wasa massage, Pina, help to improve the circulation and promote the healing. Okay. And then you'll show the patient do the strengthening technique, especially when they have injury. With strengthening technique will aggravate the nervous system, and the body can recover faster. Yeah. So levators. So this is help to elevate the scapula. So levators is the muscle that also help to elevate the shoulders. So the levator also help to your neck to do the servo neck extension, and then lateral flex to the sides of the neck. But remember, levators and trapezius upper trap for shoulder elevations. Okay, and the stretching that is the same, similar with the stretching with the upper trap, the one that I just showed you. Yeah, but you can do sitting up, you can do standing up or sitting down. Okay. So the origin is from the transverse process between C1, T4, and insert to the middle border above the level of the spine of the scapula. Action scapula elevations, lateral flexion of cervical spine, extension of cervical spine. So this is levator scapula. When patient lay down on supine, you can go from here down. Yeah, you can go from your hand. You put your hand down. You can insert into the attachment between this point right here. This is what this acupuncture point. This is small intestine 13 and 14, right? Yeah, 13 and 14, right in the angle of the scapula, where attachment of the levator scapula. So we have this small intestine 13 and 14, isn't it? Yeah. How about here? What's this acupuncture point here? 11, right? Yeah. How about here? 12, yes. How about the one underneath acromial process? 10, yes. Yeah. So you guys learn all this, and then the point along the scapula. Yeah, here. So here you have outer uvuli, like UB 41, 42, 43, 44, 45. Yeah, along the outer, in the outer uvuli, along the shoulder blade. Okay. So this is the levator scapula. So levator scapula trigger points. So the pain here, nearby the small intestine 14, yeah, and it's elevate up and then also a little bit down to the scapula. Yeah. Every time a patient elevate, yeah, elevate, it can hurt more, or a neck bending to the other side can also produce the pain. Yeah, the pain is right on the attachment of the levator scapula on the middle superior border, middle superior angle of the scapula. Okay, what is okay, this is the trapezius, the levators. So later we'll also, either today or maybe next week, we'll learn to palpate the muscle. Yeah, important to feel the muscle, also feel the trigger points. Yeah, feel where the attachment of this part right here of the attachment of the levator scapula. Okay. Okay, so radius anterior. Yeah, you want to take a break or we keep going?
Yeah, take a break.
Break? Okay, break. Okay, 10 minutes break, okay? Come back in 10 minutes, please. We have 192 slides. And we on the slide number 32. Okay? You know what? I trim it off. You see almost 200 something, 60 something. So I cut it, yeah, cut off some. Make it more easy, shorter version, more easy to understand. So too much material is not good. So who? You know William?
Yeah.
William,
he's going to Palmer now.
he from now, right? Yeah.
Seems
I heard he almost
one
graduated.
quarter left,
Yeah.
or two
Last time he was
quarters,
student, he asked me.
whether he to go.
Either go. I say, you know what? For me, if I have start over again, I don't go for chiropractic school. I go to maybe a DO or something.
Really?
Yeah, not chiropractic school.
Why is that?
I don't know.
mean-
Because in my office, I do more acupuncture than chiropractic.
Okay.
Yeah.
Okay.
I use more acupuncture.
If I could go back, I'd rather go to Davenport or Florida.
Why is that?
campus. I just didn't like the sound of it.
No.
Too expensive.
Uh-huh.
Yeah, I mean, I like Bay Area,
Uh-huh.
but if you're studying, you might want to save money
Uh-huh,
and
that's
focus on studying. But here,
Yeah.
too much, things to do, too much.
I graduated 21 years ago.
Wow.
Yeah, I got year 2000. So 21 years ago, and I graduated from 5 branches, year 2003.
Oh wow.
18 years ago. Yeah. So been practice for a long time, but majority in my office. I do acupuncture 80%.
Can I shadow you? Like,
You can for sign up for action share
okay.
next semester.
Next, sign up for it or?
Yeah.
Okay.
Will you graduate or when you gonna graduate?
Oh,
Few more years?
I got like.
Long time to go?
I just.
I have an extra shift.
Okay.
I offer internship in my office. Almost, yeah, you do internship here, you don't internship, you go to my office, you do internship. You have this, you learn more.
Yeah.
You see at least 3 hours from 6 to 11 patients in 3 hours. So the average about 8 to 9 patients in 3 hours.
Where is your practice?
In San Jose, in Alvin and Tully. You know Tully in 101?
Yeah.
We just sign up for it?
Yeah, sign up for next semester. For
Big crowd next semester.
That's gonna be good.
yeah, next semester. You know what? I never thought about it, but until last year when pandemic happened. Yeah, and I see so many students like they don't learn that much in school, so that's why I opened my actionship because open actionship is. I thought at the beginning, because they saddled me, so I have to slow down my work, and I'm so busy. But now I feel like they need it a lot more because
Were you
you see many cases in my office from Bell palsy, superior farmer syndrome, carpal tunnel syndrome, tennis elbow, all that sign symptom. The test I will perform the test and also the treatment. So took my class. She took my class. She took my actionship.
I'm in his externship now.
Yeah.
Oh, really?
Yeah. I see him on Thursday.
Thursday.
On Tuesday.
So far Thursday you have about 10 patients.
Can I go this Thursday? Just
No,
to-
2.
No.
2 is the max. But I can you know
Okay,
what? I can allow you guys can observe. It's okay.
Yeah, that's
Maybe
what I'm
observe
saying.
for 1 or 2 hours. That's it. But
Yeah.
not 3 hours because it's not fair for them because they record.
Right. Okay.
Yeah, because I limit the.
I understand.
My office is so small.
Okay.
If my office is big, then I can take more students.
Right.
But next semester you can register.
Okay.
For sure that Thursday for the whole day. So 4 slot.
Okay.
Monday 2 slot. In the morning 2 slot. In the afternoon 2 slot. And then Tuesday maybe in the morning. Yeah. If I'm not teaching in the clinic next semester here, then I have the whole day Tuesday, whole day Thursday. So 4
I'll
classes.
sign up for sure. I didn't know.
Yeah.
Were you doing it over like last year, COVID?
Oh yeah, we started from last fall. Last fall we have 4 classes.
But you can only do it if you're at the the place where you can take internships.
So
Like
I'm not
depending
there
on your
yet.
how many intern rounds can you take? Or you
I'm taking theater 2 now.
Oh.
so you still have to go through rounds.
Yeah.
Yeah, you have to go to the round
Yeah.
and then you have to
Okay, then maybe next year.
Yeah.
yeah.
Or I try to go like Santa Cruz and San Jose campus all rounds next quarter.
Yeah, just
Get
like
done.
it's like yeah.
Yeah, you have to be in the level.
It's
In the round,
finish
internship
up to
level.
4 intern rounds, and then you
You
can
intern. Huh?
So I mean, do you prefer like an entering internship or the towards the
Like bus
end
is
of the internship level?
No, it doesn't matter.
It doesn't matter.
If you go into the intern round level, then you start internship, then you can take internship.
Okay, I try to register.
Yeah, if you take this class and then you take regular time in Ortho, it's easy for you.
Yeah.
Easy for me to talk and to explain and you understand.
Sure, yeah. Yeah.
So here in 3 hours, you know what? Like today, we have any patient. My God, we sit there for 3 hours and we don't see any patient. Yeah, here and
It's intern
clinic here
rounds.
in the round. None patient there. Last week, no. Huh?
Same for my.
Yeah, I don't know what the point. What the point for me to sit there for 3 hours and
Do you just lecture or what do you do?
Yeah, I lecture them. I give them some case study and I lecture them all the the conditions.
We have 2 patients like they have the slot there. They put their name down, but they never show up. We call them in the.
Yeah, should call usually case like that. We call day before.
Yes,
Remind them.
the receptionist, they called the day before, they said they will come like 2 hours
Yeah.
before the section, and then they just called in and they said, oh, I cannot do it today. And
Yeah, that's why. That's a policy that is that a new patient or returning patient?
I think it's a returning patient.
Then chart them. Chart them. Yeah, they no show, no call, no show.
Yeah, that's what they do in Santa Cruz. If they don't show you, there's a piece of
In my
paper
office?
that goes on.
In my office, I chart them. The first time I, courtesy, okay, forget it. But second time, I chart them.
Because otherwise they would do it again and
Because I cannot book any other people.
Yeah, I think it's just better to just keep your externship and just that you'll have patients during that
Yeah.
time. So
Yeah, but externship is booked full. This week is
It's hard to
Because
get
they,
in.
I know, because there's only so many things.
yeah, because it's small, maybe it's small. Big, then it's okay. But it's small.
Keep applying.
Yeah.
Keep trying to apply for.
Oh, you can get in?
No.
You're on the internship level now?
Next term.
Next term, then you can direct.
But entering level.
What semester are you?
Entering 8 next semester.
You have I think more seniority. If you're around 8 or 9, you have like more seniority compared to other people. Because I'm right now I think the same 8,
Oh.
and I got into his externship this trimester. So I think it's next.
So next term is 8 for me.
Yeah, it should be okay. Hopefully, like you'll have like more chance. Hopefully.
Do you apply for the 3-year program?
I'm doing still 4-year because the clinics, I wasn't doing that many clinics during COVID, so I'm really behind on clinic, but I'm ahead in academic, so it's still probably going to take me time to get through all the clinics. Yeah, so it'll probably take.
Oh,
I'm so behind.
Dr. Tran,
Mm.
I didn't know it's in class last week, so I missed
What?
last class. I missed it because I didn't know it's
Which one? This semester?
He doesn't take attendance.
No, I don't care. Seriously, this class, you can miss it 1 day, 2 days. No problem. You don't not worry. I never take a role.
I think I learned most of it from Palmer.
Yeah.
But I'm really interested in the treatment part.
Yeah, we'll do the needle.
Yeah.
Maybe
I-
today we'll see how far we go. Maybe next
Okay.
week I'll give you guys some time to needle trigger points.
Alright.
Yeah. Let's go. And then we'll do needle trigger point and
Actually, I have a question. What if you had to describe what's the difference between like doing like toina and doing like the kind of work that you do as a chiropractor? What's the difference?
chiropractor doesn't do tweener.
But they do a lot of like.
Adjustment, joint manipulation, adjustment is different with tweener.
What's Tuna though?
Tweener is the massage, but they also
Yeah.
do some bone adjustment, like manipulation.
Also adjustment, but like a different
But it's
type
different. The
of.
way they they do it's not specific. They don't, they also do some more long leverage, not a more specific, not specific like a chiropractic. Chiropractic they do more of this. Like me, sometimes I do the stretching.
Yeah.
Yeah, the stretching, some little muscle work and adjustment. But that's what I developed. That type of technique to help the patient. It's not the technique that I learned in school. I learned it's only adjustment. Okay. Not all that kind of stretching,
Pulling.
pulling, and traction.
Because I'm learning Plina now, but this is my first time learning about it, and so it's like trying to figure out what's the difference between all the different kind of like body work.
You can combine them two together, whatever is be the best for you and more convenient for you. Everybody different technique, but if your technique is make patient feel better.
Yeah.
Looks like some of the moves.
So it's like they have like rolling as like a basic technique where it's like they like roll. I don't know,
Roll.
Yeah, rolling.
Roll the hand.
Rolling.
Like roll the hand.
Yeah, they use like a hypofenar eminence and they roll onto the knuckle and then back. And it's just this back and forth. And it looks really easy, but to actually do it correctly is much harder.
Exactly. Okay, let's continue. Continue. Serratus anterior. Serratus anterior is used in activities with draw the scapula forward. So this guy, you push your hand forward. That you use a serratus anterior muscle. Okay. Doing push up. Yeah, that help strengthen that muscle. Or people practice boxing, japping. Yeah, use that muscle. See, boxers have a well developed this muscle, serratus anterior muscle. If you look at the martial artists like Bruce Lee or Pacquiao, Yeah, Manny Pacha, the guy that from Philippines. Yeah, he's a very well developed. I think I have a picture. Yeah, there you go. You see this? This is the serratus anterior muscle. Yeah, this is the muscle right here. Yeah, see the muscle here? Because if you love Japan, this Japan that you have to use that serratus anterior. So serratus anterior with the pec major, pec minor, it helps to protract your scapula. Yeah, the scapula move forward, you use that three muscle. Pec major, pec minor, and serratus anterior muscle. Okay? So it's used strongly in push-up or bench press. You do bench press, yeah. So bench press, when you lift, make sure when you do it, bench press, I see some people go halfway and go down. Yeah. So make sure you go all the way up, and you go all the way down. Yeah. You don't go half and half like that. So up. Yeah. So that's, you work on that muscle. Okay. Wing of scapula are indicator of having a weak serratus anterior muscle or lesion of long thoracic nerve. So the long thoracic nerve is the nerve that innervates the serratus anterior muscle, and people have a. Let me show you the. So this is serratus anterior muscle. Yeah, muscle attached from the rib to the scapula. Yeah, so every time this muscle contracting, it pulls your scapula forward. Yeah, so this work along with your pec major and pec minor. Alright, so this is the long thoracic nerve. The nerve that go all the way from underneath the scapula, go down to innervate each muscle here. Yeah. People have an injury, especially overstretched the brachial plexus, fell down on the shoulder, up on the top of the shoulder, and that can damage the long thoracic nerve, and this can cause this muscle to become weak. So when this muscle become weak, what happens? The scapula will pull more backward. Right? Remember, muscle on the back and muscle on the front have to be balanced, have to be, contracting, balanced equally. If in the front is weak, what happens? The muscle on the back will pull backward. When it pulls to the back, and then you have we call wing of scapula, or winging of scapula. See where the winging of the scapula, right here. This is a winging of scapula. You see that? Yeah. So when people come in with these conditions, if they stand up and on the side, on the back side here, is scapula pulling back like that, and you know that they have winging of scapula because of either they have weak serratus anterior muscle, or they might have some long thoracic nerve damage. If involved with like accident, like car accident or trauma, sport injury, could be from the injury on the shoulder, between the neck and the shoulder, that damage the long thoracic nerve. So wing of the scapula, injury to long thoracic nerve. So long thoracic nerve is come off from the nerve root C5, C6, C7 nerve root. Yeah. So this is description for the nerve. It passed through the scalene muscle, and also come down to. It's connect with the C7 nerve root, become the long thoracic nerve. So trauma, microtrauma, acute trauma, head trauma, or people fell down on the sides of the neck can injure this nerve. Tackling in football, in football player, yeah, when they have a tackling, the helmet goes straight into this area, depress the shoulder, and that also can damage the long thoracic nerve. Okay. Or people practice wrestling. When you throw them down and they land on the shoulder, yeah, it can also damage that long thoracic nerve. Okay. Also, the scalene non-traumatic cause includes a compression at the one side many sites. A scalene muscle. Yeah. People have a scalene muscle tightness. With scalene muscle tightness can also damage the long thoracic nerve. Maybe next week we'll needle scalene muscle, palpate and needle scalene muscle. Have you guys needled this point before? No, never do this point. So the scalene muscle, we can go straight into the scalene muscle, and we can go from here, go down to the scalene muscle. Okay. So the scalene, later we'll talk about scalene muscles. Okay, sign symptom, this pain and discomfort above the shoulder, neck, and the scapular area, exacerbated by activities or by tilting the head away from or elevating the affected arm. Weakness during overhead activities, decreased active forward elevations, and lost the power and the strength, wing of the scapula, losing the muscle tone. Okay, treatment. Good thing that this one can recover. Spontaneously can recover. No surgery needed. Yeah, important that we need to strengthen in the serratus anterior muscle and strengthen the scapula stabilizers, especially the trapezius, the rhomboid, and levator scapula. So those muscles, the trapezius, the rhomboid, the levator scapula, they are attached to the scapula. It helps to stabilize the scapula. If you can strengthen those muscles, it makes scapula is more stabilized, the scapula better. At the same time, you strengthen the serratus anterior muscles. Cupping, wasa, twina, maxa. You can maxa along the GB point, GB 20, GB 23, GB 22, GB 23, and then also cupping. Be careful when you cupping on the rib. Especially if you cupping, leave it too long, it can give you a blister. This area is very sensitive. So if you don't leave it too long, if you look at the color, if it change to red, take it out. Yeah, because here is only skin and bone, and you have a muscle, intercostal muscle, right? Intercostal muscle is between two bones, and a very sensitive area. You can create a big blister. Yeah. One time I have a patient that he injured his rib by bending and lifting something, and he injured, and he didn't know. He used a cup, like hot burning, he cup on the area, and he left it there for long. And when he moved it, he had a big blister. And then he went to see his doctor, and his doctor said that, oh, let's poke it to let the fluid leaking out. And then when he poke it, and the skin come up, and you see red, the whole red area like that, like cuff. When he came to see me, and he told me that his doctor asked him to poke, and his doctor was trying to poke and release the fluid out. That's crazy. Probably that doctor been graduated almost I think 30 or 40 years ago. No one will do that, especially when you have blister like that. Leave it alone. Over time, your body will reabsorb it, and then it will come up by itself. You take it off, you peel off the skin, what happens? You can get infection easily. Make sense?
Yes.
So when he told me that his doctor told him to do that, oh my God, I said, maybe his doctor is graduate from medical school like maybe 40, 50 years ago, or never do that. No. They don't take it off. You just leave it like that, because your body will reabsorb it, and then the skin will fall off, and then new skin regenerate, right? But when you remove that skin, you can get infection easy. So remember, don't cup in, especially cup in the rib. Don't cup it, don't leave it too long. You leave it maybe 30 seconds, 1 minute, but if you see the color change, just take it out. It's a very sensitive area. Yeah? Wasa, you can do wasa along that muscle, that's good. And twina, if you do mapsa along the muscle, it's okay. But when you do wasa, okay, when you do wasa, do along with the rib, like this. Yeah, when you do wasa, do it along with the intercostal muscle. You don't do it like that because it will hurt. You will hit the bones, right? The rib. Huh?
Or tickle.
Yeah, so you do this. Yeah, you wasa, you do go along with intercostal muscle. Okay? Needle trigger point, yeah, needle local point. You can palpate, feel the point, that tendon spot. You can needle, yeah. So when you needle like that, you have to create the immune response. Yeah, you bring more of the circulation to the area. So if you have more circulation to the area, it will increase the promote the healing, right? So that's why now in the sport medicine they use the technique they call plasma cells therapy. Yeah, platelet plasma cell therapy. So when you get injured, what happens? You also see a specialist, the sport medicine doctor. They withdraw your blood, and in the blood they put into a centrifuge to separate the plasma cell and red blood cells. So in the plasma cells, there's a lot of platelet. Yeah, so they use that plasma cell, they inject into the area that you get injured. So with the plasma cell with the rich platelet will help to pull more circulation, will draw more the blood, red blood cells to the area too. And then if you have more blood cells to the area, you recover faster. So that's the technique that they do for in the sport medicine now for people who want to speed up the healing process. Yeah, especially the area that have the big joint, like the knee joint, the shoulders. Yeah. Okay.
Does that have any side effects?
This one.
That.
Plasma.
Yeah.
Platelet. I don't know. I don't know if there's side effect. I think if you use your body,
I mean,
they use your body, your own body, platelet and
well,
your
if
plasma.
you're
I don't.
clean, sterile, then I think it's fine. But
Yeah,
because of the platelet creates scar tissue.
platelets create the scar tissue.
Scar tissue really quick. So you'll go to that slide of injury,
Mm-hmm.
just on top of it, increases like
That
scar tissue
formation.
formation rate.
Mm.
But
I don't know.
I was wondering.
Google. Yeah, but if I think I think they still under they call it investigational,
Okay.
experimental, whatever. All that procedure they pay.
Technology.
All that procedure is paid by cash. Insurance doesn't pay for.
Oh,
Yeah, doesn't pay. I have a patient that she got knee arthritis for a long time, and they want to do that technique, inject into the knee to help to speed up. One patient had that problem, spent about 7,000 cash, and it still didn't work. And then I have another patient come in and ask me if she can use that. I say, I had a patient like this, but it's up to you. You want to do it? It's up to you. But they cannot guarantee. They call it still under experimental, whatever. So it's they have to pay cash. Insurance doesn't pay for it, and the treatment is cost about 7,000 to 10,000
For treatment?
for the few sections for treatment, the whole like a package for few treatments. Yeah, so they take out your plasma cell, they separate the plasma cell and red blood cells, and they inject into there. Okay, rhomboid. So rhomboid, there's two rhomboid, right? Rhomboid, we have rhomboid minor and rhomboid major. The rhomboid is attached from the spinous process between C7 to T5 and to the spine, to the scapula, to the middle bottom of the scapula. And then you have a rhomboid minors. Rhomboid minors start from C7 to T1 and go to the scapula. And then rhomboid major from T2 to T5 and also attached to the low bottom of the scapula. Okay? So every time the rhomboid muscle contracting, it helps you to retract the scapula. Okay. So action, the scapular retraction, bring the shoulder blades together. Rotation the scapula downward. Yeah. Also, you can use that the rhomboid minor and majors. Pull and draw open. So you try to pull and draw open. Yeah, you use that. So people do a rowing, right? Rowing, the one that you do. Row. Yeah, rowing, that you use that muscle. So professional rowing. If you look at the posture, if you look on behind, the muscle is like that. The scapula pulling back, and if you look at the between, it's like canal. In between the scapula, two scapula on the right and left, and the spine is like a canal, because the rhomboid is so hypertrophy. So one time I was in a clinic in Santa Cruz. Well, a patient that he sees doing a lot rowing, and then if you look at her posture, her scapula is like that. So people like use a lot of this kind of maneuver. So in the gym, especially for men, when you work out, right, you work in the front, yeah, but also you need to work those muscles on the back. The rhomboid, the middle trap, because that will help to bring the scapula backward. Yeah, if you work too much in the front and the muscle on the back is too weak, your shoulder will be like this. Yeah. So when your shoulder like this, what happened? What happened? What condition you might have? You might have many problems. People have a difficult with breathing. Yeah, the air, feel like the air cannot get in that much because it narrow the lung capacity, right? Not even that, they can have a pain go down to the hand, to the fingers, because of the condition we call thoracic outlet syndrome, due to the Pec Minor tightness. Yeah, shoulders, when your shoulder roll forward, it can put a lot of pressure on your subclavian artery vein, the brachial plexus, and cause the numbness go down to the hand, to the fingers. Okay, so very important that your body always balance. The muscle in the front, muscle on the back have to be balanced. The flexor, extensor have to be balanced, so that it can put equal pressure in the joint. So when the muscle is imbalanced, it put the pressure unequally in the joint, and that cause over time, it can cause degeneration, arthritis. Yeah, it's increase the it make your body breaking down faster. Yeah. So everything balance, the muscle balance, not even that, it help you to perform better. Yeah, perform better, especially for athletics, like with performance. Yeah, or if your muscle is balanced, or it will make you compete better. Yeah. But when your posture is unbalanced, or the muscle is imbalanced, your body will consume more energy, and the pressure will put more pressure in the joint, and it will slow you down. Not even that, it will break down more. Yeah. Make sense? Yeah. So on way, muscle on way work in the, have to be balanced together. So every time, for example, if I do this, normally this is balanced, right? So I mean this muscle, and this muscle work together, right? Keep my hand straight like this. But if my flexor is too strong and my extensor is too weak, and my hand will be like this. Yeah. If you have a people with the radial nerve injury, because the radial nerve is control the wrist extensors, right? With radial nerve injury, this muscle become weak, and then my flexors, wrist flexor become over strong. My wrist will be like this. Yeah. Same thing with your posture. If you work too much in the front, like people can posture for many years, posture be like this. Yeah. So it's okay like that when you analyze the postures with the roll, shoulder roll forward, always stretching muscle in the front, strengthen muscle on the back. Yeah, to balance, right? If muscle is over strong, you stretch it out. If muscle is too weak, you strengthen it. Yeah, make sense? Okay. Okay, this is the rhomboid. Yeah. Okay. This is where the trigger point for the rhomboid. And you see, people with the chronic rhomboid muscle strain, yeah, especially people with computer work for many years. See, they come in, they complain of pain along the rhomboid inside on outer UB line, around UB 41, 42, 43, 44, 45, along that outer UB line. And when you palpate, you can feel the tenderness spot along the rhomboid muscle. Yeah, not even that. The pain here, because the pain here is so sensitive, so tight, and can pull all the way. Patient might have the pain that radiate into the spine. Yeah, into spine. So sometimes we treat patient with the rhomboid muscle strain. We use the outer UB line, but at the same time we use inner UB line. Like the inner UB line, like UB 12, 13, 14, 15. Yeah. And outside we do the UB 41, 42, 43, 44. Okay? Okay, shoulder stretching. So how you do the rhomboid stretching? So this is the stretching. But for me, when I do the stretch, I don't feel that much. Can you feel it? Can you feel much? I don't feel that much, right? So this is another way to do the stretching. You pretend that you hold a big tree, right? So you try to expand out from the back. Can you feel it? Feel more, right? Yeah? You tuck your bum to anterior. Yeah? That's one stretch. Then another stretch that I go on the sides. So I like this stretching too. So here I can feel more. See, I go on the sides. Look. Yeah. You see this? So this is also help to stretching the whole side, back of my shoulder. Okay. But here, this kind of stretching, I don't feel that much. Yeah. Can you feel it? Can you feel it? No? Yeah. Yeah. Or sometimes you can hold as a pole, you know, there's a pole you can hold your body and you stand like that and you lean back. You lean your body to the side and you can feel more. So there's many ways you can do this stretching. The one that you practice Qigong, right? There's a posture like this, you hold. Inhale. Hold for 1, 2, 3, 4, 5 and let it out. Pretend like you hold a big tree, holding a big tree. Okay, inhale. And let it out. Okay? Or you can do like the posture that you on your hand. You call it a cat. You know the cat posture? The one that you do this?
Cat camel? Cat cow.
Huh?
Cat cow.
Yeah. So this one is also help to expand those muscles on the back of the rhomboid.
Oh.
You try to bring up and you bring your scapula upward.
Okay.
Yeah? Make sense? Yeah? Have you tried that posture before?
Yeah.
Yeah? That was good. So people also have a tightness of the rhomboid muscle. What happened? Sometimes they can complain of the shortness of breath. They feel that the air cannot get in completely. Especially when they have a lot of tightness along the rhomboid area muscles. Yeah. Because the rib, in order for the air to get in, what happened? The rib is expanding out, right? So the rib is attached from the sternum, go all the way down to the back, and it attached to the transverse process of the thoracic. Okay, start from T1, go all the way down to the T12. So we call it the costal transverse joint. So the joint between the rib and the transverse process. So those joints, if the muscle is so tight, it can put more pressure in the joint. And some people say that, oh, you know what? Every time I breathe in, I don't feel the air getting enough to my lung. So, and sometimes you treat them along the rhomboid muscle, release the tension with the cupping, with acupuncture, stretching. They can feel better. They can breathe better. They feel more. Or, people with this, sometimes I adjust them. I adjust from the back, from the front to the back to open up the joint, and that will make them feel more better with the breathing. Okay. Rhomboid muscle strain. So rhomboid muscle strain is the, yeah, we talked that in the previous class too, but so we don't want to repeat it again. But again, the strain is of this muscle, and then you have pain along the scapula. Okay, the Pec Minors. So by the way, the treatment here, yeah, you can go along, you can thread in, you can use earlier, you can use with instead of 1-inch needle, you can use 1.5 soon. You can thread in from the UB41 down to UB43. Yeah, you can thread it down, but angle. Make sure you angle the needle. The area that when you needle the area along on the rib, in the front, even on the back, go straight into it. It's more dangerous. So the better way is angle. Yeah, angle the needle. Go along the muscle. Yeah, go along the muscle fibers. You don't go straight. If you go straight, it's okay, but don't go too deep because you might puncture the internal organ, right? Okay. But in the rhomboid here, you can thread in from UB41 down to UB43 or 43 down to 45 for the outer, and even in the UB line, you can thread in the needle down. Yeah. Okay. So we talk about that. Pec Minor. So Pec Minor work together with the serratus anterior muscle, with protracts and then rotate. So it's like that. It helps to protract and rotate the scapula upward. Okay. When to work together, purely protraction without rotation is produced. Tightness of this muscle can cause the condition we got thoracic outlet syndrome, TOS. Remember last time I talked about TOS? TOS can cause by cervical rib, can cause by skeletal muscle tightness, can cause by approximation between the clavicle and the first rib, and then lastly it can cause by Pec Minor tightness. Okay, so this Pec Minor tightness. Okay, so look at the muscle here. This is the origin from outer surface of rib number 3 to rib 5 and insert into the coracoid process of the scapula. Yeah. What another muscle that attached to the coracoid process of the scapula? Anybody remember? Yeah? What a muscle? What a muscle? That's right, you point the right muscle, but then what, remember the name of the muscle? What muscle that attached to the coracoid process? Remember? Huh? Bicep? Yeah, bicep. Which one? No, long head is outside. Short head. So short head attached up to the flex, and also flex the whole arm with like this. Okay. The coracoid process of scapula. So action, protraction, scapula protraction, rotate. Yeah. Pushing the door open. Okay. Okay, this is the Pec Minor. See that? Underneath is the Pec Minor. And here's the Pec Minor here. And then people with the trigger point for the Pec Minor. You see the trigger point with the Pec Minor and the pain radiate down to the middle border of the forearm. Yeah. Why they draw this picture? If you look at this picture, is yeah. So more this like the lung channel, the heart channel, right? Yeah. Okay, but this is the because of underneath the Pec Minors, you have the nerve root, the C8 and T1 nerve root. Yeah, the nerve root that usually got entrapped in the TOS is more usually is the C8 and T1 nerve root, and C8 T1 nerve root is control the dermatome is this part, right? Yeah, dermatome of C8 T1. You guys remember all the dermatomes? C5, C6, C7, C8, and T1? 5, 6, 7, C8, right? So C8 will cause the numbness here. Okay, so that's why it's because it's involved with the C8, T1 nerve root. Then most of the time the pain will radiate down to this area, this part. Okay, so thoracic outlet syndrome, you guys can review in previous class, so we don't want to talk about it. Okay? Even the test, remember last week we talked about the rules and the right, yeah, for the Pec Minor, and how you do the stretching for the Pec Minor. Let's do the stretching. So stand in the doorway next to the wall, bend the arm as to stretch it, and place the forearm flat against the wall and the door frame. Step forward, rotate your shoulder away from your outstretched arm and hold up to 10 to 30 seconds. So like this. Or you can stand in the front of the wall, right? Bring the arm up, about 30 degrees up, 30 to 45 degrees up, yeah? And you lean forward. So when you lean forward until you feel the tension and you turn. Okay, same thing. Over here. Lean forward. Okay, until you feel the tension and turn. Hold this maybe about 15-20 seconds and go the other side. So that is how to stretch in the Pec Minor. Yeah? Remember, I'm up. Because I'm up, you will right on the angle with the Pec Minor. 45 up. 45 up, and then lean forward and turn. You guys know this stretching? Yeah? Also another stretching, yeah, like this. Stand behind, or I like to do this even on the wall like this, on the door. You can lean forward, yeah. Or you step forward like this. See? You can do both hands, both sides. And you can go up and down and you can feel it. So like this, you can feel more. Yeah? Make sure you hold correctly, you don't stand like this. Your hand is on the same line. Your feet will be on the same line. And you lean your body forward. Okay? And you can move your arm up and down. Okay. Scm. So origin attached from the anterior surface of upper sternum and inner part of the clavicles. So this is the sternum, right? This is the clavicle. The clavicle, the sternum, right? And then insert to the mastoid. This is a mastoid process. Yeah, the mastoid process. So remember, underneath the mastoid process here, you have the earlobe. So this is the one of the acupuncture point is? Huh? No. Senza 17. Senza 17. Yeah?
Yeah.
The mastoid process behind the earlobe. Senza 17. Yes? Senza 17. Do you remember? For tinnitus, ear tinnitus, that point work with the 1921, the one inside the hole. 1921. The 19 what is the SI small intestine 19. Yeah. So that's 2 points for tinnitus. Yeah. But also this point, Senza 17, rise underneath the mastoid process and also behind the earlobe. Okay, so it's contract on the both sides, help to flex the neck. So flex the neck, you use that Scm. Contraction on one side only is lateral flex, yeah, to the same side and rotate to the other side. Innervate by spinal accessory, So daily use, looking at the floor, looking over your shoulders, holding the phone between the ear and the shoulder. So this is the SCM trigger point. Especially people with the bad posture. You see people with the bad posture, head forward, prolonged head forward. So what happens when with head forward? So with prolonged head forward, you have to overuse your SCM, because the SCM, both our SCM have to flex the head, right? So with people with prolonged head like that, so it makes increase the hypertonic, increase the muscle tightness of the SCM muscle, and that over time can have little trigger point along the SCM. And the SCM here, trigger point can refer that to the head and also to the eye, to temporal area. So SCM stretching, start facing straight forward with your arm in the front, keep the elbow straight, clap your hand together to stop the shoulder from elevating, turn your neck so that your chin move to the shoulder. So when twisting your head, lift your chin slightly up. So you can hold like this, clap your hand, and like this, and you can turn. Yeah, you clap your hand in front, okay? Stop, shoulder elevate, turn your head so that your chin move toward your shoulder. Yeah, chin to the shoulder, okay? And then you twist your head and slightly lift it. Can you feel it? Yeah, or you can do it this way. Remember earlier I showed you this way, you hold the shoulder out, pull out. Yeah, tilt your head up. This way, this stretching the SCM also help for your scalene muscle. You look it up, chin to here and then slightly elevate. Okay? Hold that between 10 to 30 seconds. Okay, deltoid. So the deltoid is divided into the three portions. So all the stretching, you gotta remember, just know the muscle, right, and the stretching for that muscle, and also know the clinical. Yeah, what is the trigger point? Yeah, how you find that trigger point? Then we'll do that next week. Yeah, next week we'll do needling. We look for example, we palpate the SCM, and we look for the trigger point. Look for tendinous spot, and we needling. Okay, same thing on the trapezius or levator scapula. Yeah, rhomboid muscles. Okay, deltoid. The deltoid divided by three portions: anterior, middle, and posterior. This is anterior, middle, and posterior. So anterior deltoid have to do this: middle deltoid, posterior deltoid. Yeah. So anterior deltoid, middle deltoid, posterior deltoid. So when you check you check the strength of the muscle. For deltoid muscle, you ask the patient to lift your shoulder up, yeah, and you press down. Okay? Shoulder abduction, you press down. Turn the shoulder to the back and lift it up, and you press down. Then you can check three portions of the deltoid muscle. Can I borrow your shoulder? Can I borrow your? Can you stand up, please? Okay. So if I check for his anterior deltoid, forward. Okay, lift your shoulder up. Yeah. Middle deltoid. See the middle deltoid up. Yeah. Posterior deltoid. Bring to the back, and then lift up. Got it? Thank you. So that's you check the strength the strength of the anterior portion, middle portion, and posterior portion of the deltoid. Okay. So anterior deltoid for shoulder flexion. So posterior deltoid for shoulder extension and external rotation. And all muscle help for shoulder abduction. So this is shoulder abduction. Shoulder abduction. It's innervated by axillary nerve. Axillary nerve is go underneath the armpit and control the deltoid muscle. People have a shoulder dislocation. With a shoulder dislocation, it can damage this axillary nerve, and people will have pain around the shoulder, right? And with untreated shoulder dislocation, what happened? Over time, you can see the muscle, deltoid muscle atrophy, flaccid, because it's damaged the axillary nerve. Not even that, because you're not using the shoulder joint. So the shoulder will the muscle will get flaccid and atrophy. Okay? So daily use is for lifting. So this is where the deltoid muscle. So anterior shoulder stretching. Stand upright with back straight, clap your hand behind your back, and slowly lift your hand away from the back, upward ceiling. Like this, yeah? And then you lift upward ceiling. Yeah? You bring your arm up, bend forward. So that's for anterior shoulder stretching. Hold that for 10 to 30 seconds. You're stretching anterior deltoid muscle and also the pectoralis minor. Yeah? You hold from here, and you bend forward and you lift your shoulder. Can you feel it? Yeah, you lift it up. Yeah, you lift it up. When you lift it up, you're stretching in front. Yeah? Hold that, you lift, you hold that. Flexible, huh? Some people very flexible. Yeah, you can do like, if people practice yoga, you can do a lot more. You can bring the shoulder more up. Yeah, because when the joint is more flexible, and you can move further. Posterior deltoid stretching, shoulder stretching. So this posture right here, and lift it up. So you know, right? You know this stretching. Later, if you have a patient with the bad postures, especially pain in the front, tightness of Pec Minor, then you can also show them this stretching. Okay, so the deltoid, this is where the deltoid trigger point. Okay. Okay, supraspinatus. So let's finish this muscle and we're done for today, and we'll come back next week. Okay. So its main function is to stabilize the upper arm by holding the head of the humerus in position. So this one is supraspinatus is help to abduct the shoulder. Yeah. It's start from the supraspinous fossa and then attached into the greater tuberosity of the humerus. Which acupuncture point is on the supraspinatus muscle? Which acupuncture point is on the supraspinatus muscle? Right on the supraspinatus muscle. Which one?
14.
You guys should know. Huh?
LI 14.
No, LF, no. Supraspinatus.
What was the question?
Supraspinatus. Which acupuncture point is on the supraspinatus muscle?
Is that SI12?
Yes, SI12. SI12. So people with the supraspinatus tendonitis will do the small intestine 12. Small intestine 12, needle small intestine 12, port to the shoulder. Okay? So this is the stretching for supraspinatus. So the condition relate with supraspinatus, we talked in the previous class, like supraspinatus tendonitis, impingement syndrome on the supraspinatus tendon. Okay, so I don't want to repeat again, because if I repeat again, it will take forever. Okay, and then supraspinatus stretching. So, have you seen this stretching before? Maybe no, right? Like that, and you pull your elbow forward. Hmm?
A kid's dance.
Mm-hmm. Bring your shoulder forward. So this stretching, you're stretching out the supraspinatus. Okay? Bring your shoulder forward. Put on the wrist, on the weights, and then bring the shoulder forward. Okay. Next week, maybe the first 30 minutes or first hour, we'll needle the point on supraspinatus, the point on the SCM, the point of trapezius, levator, rhomboid. So all that point we needle. Easy, right? So next week you guys can wear a tank top. So more easy to pair up and needle. Yeah? Wear a tank top. Or if you have a gown, or you guys can put on the gown. Whatever. Or if you don't feel comfortable, then it's okay. You can feel palpate. If you don't like needle, you can learn palpate the muscle. Feel the muscle. Even, you know, some people might say, oh, you know what, I never feel the infraspinatus muscle. I don't know where it's located. Or in the supraspinatus muscle. So next week we'll learn palpate, feel that muscle. Not even that, you feel the trigger point, the tendinous spot on the muscle. Yeah. Or then also practice needle into that trigger point. Okay? So we end today right here, and then I'll see you guys next week.